I think all this business of free for everybody is a disaster.
Well, it won't resolve the problems because it'll be like throwing gasoline on a burning fire in an effort to put out the fire.
Healthcare reform is at the forefront of President Obama's agenda. As his allies work to push through their version of healthcare reform, questions regarding rationing, loss of choice, and quality of care are in the mind of many. No one would disagree that the United States currently offers the best healthcare in the world, and all agree that quality healthcare should be accessible and affordable. But this is where the agreements end and the debates begin. I'm Amie Beth Shaver for API New Media, and this is what you need to know.
The thing again that scares me is the speed by which it's going and how many closed-door meetings there are that talk about major provisions of these bills. I am frightened that we're going to wake up one day and what we read today isn't the bill that goes to the floor, and it's an entirely different bill, but we haven't the opportunity to comment as citizens or as professionals in the healthcare field.
If government-controlled healthcare is passed by the U.S. House and Senate, it will affect all Americans as government controls more and more healthcare resources and makes more and more of the decisions. With this approach to healthcare, some new things will become common to your healthcare experience.
Since they're not unlimited resources, the government is going to be forced to impose cost restrictions. And in essence, what that effectively is a price ceiling imposed on the provision of healthcare services. It'll be imposed on doctors, what they can earn. It'll be imposed in terms of the amount of healthcare services that will be provided for people. And so the end result of any kind of price ceiling is a shortage of the good.
Healthcare will then be run on a budget. And when that budget runs out, you could think that there's not going to be any healthcare delivered when that budget runs out. So I believe what will happen then is that patients who have absolutely needed care will be given care, but people who need care to improve the quality of their life may be denied that care once the budget runs out. So I could see a situation where rationing will come to every American if the government controlled healthcare.
Government-controlled healthcare will allow the government to apply its value of human life. Consider the baby boomer generation approaching older adulthood. This group will be some of the first in America to experience a denial of care. In England and Canada, the delays and denials of care affect almost everyone, but fall hardest on older patients. Dr. Eric Solomon, a physician in Alabama but formerly of Canada, describes the experience of a friend's father back home.
His father, 90 years old, great health, independent living, his wife's alive, had a hip fracture. They waited 4 days to operate. Here they would have waited 1 day, got pneumonia, had respiratory distress, and they wouldn't admit him to the intensive care unit post-operatively because he's over 90. And he died 2 days later.
2 years ago, I found I was having problems with my back and my hip. I applied for an appointment for the NHS, with my NHS doctor. I had to wait 3 months to be put on the list for the appointment. Then I got the appointment, was sent for a scan, for which I had to wait another 3 weeks. And then they lost the scan. And in the end, I was so bad I couldn't walk. I went to a private doctor. Fortunately, I can afford to pay for one. But these are the problems. If I had not, and my age was against me, as the elderly people are being sidelined. If you're over a certain age, they don't come, you haven't got the same quality of life, not the length of life, so you have to wait. You wait.
I don't think anyone could stand that delay. We don't like standing in line at McDonald's.
Government-controlled healthcare brings delays and waits unlike anything Americans have known. According to the National Center for Policy Analysis, 1.8 million people in England currently are on waiting lists for hospital admission or outpatient treatment. In Canada, the average wait time for gallbladder surgery is 9 months. For a knee replacement, it's 18 months. According to Canada's Fraser Institute, Roughly 827,000 of Canada's only 33 million citizens are on a waiting list for some type of medical treatment.
There's no competition, no incentive to improve, and so there's stagnation in the advancement of health care that we take for granted.
And the National Health Service has gone down. The hospitals are not as good. They are dirty. They're understaffed. The staff are not paid enough.
And that's what happens with it when the government gets involved in it. The cost can't be controlled because no one's really paying enough attention. There's no incentive for them to control the costs.
Government-controlled health care will substantially weaken the market for private plans, making them too expensive relative to the government plan. Estimates range from 83 million to 108 million people could lose their private coverage and be forced into a plan that cuts fees to doctors and reduces access to technology. Ultimately, when you reduce access to technology, that will result in less money being invested in the development of new cutting-edge technology.
I think advanced technology will suffer. Advanced technology in the delivery of healthcare is usually brought about by the efforts of entrepreneurs who are trying to make America the best. And I believe that when their incentives to do that are taken away by the government, great technology will suffer, without a doubt.
Americans have access to the best medical technology in the world, but residents of those countries with government-controlled care have something entirely different. According to Dr. Eric Solomon, doctors in Canada find the technology to be lacking.
Technology is definitely not there. And one of the reflections you can tell is that the specialists have left Canada more so than the family practitioners now, because an orthopedic surgeon, for example, would not have access to an MRI on a regular basis. It might be a 3-month wait or private, and they can't practice like that.
I believe currently Toronto's metropolitan population is something like 5.2 million people. That includes all of the outskirts and suburbs and all the other things that are around it. And I think they still have 3 MRIs. They may have 4 MRI scanners for the entire city.
Another thing that nationalized healthcare brings is loss of choice. Nationalized healthcare will mandate the details of healthcare to individuals and to business owners, requiring participation in the national plan and imposing fines for those who refuse. Employer mandates could result in reductions of wages or the ability to hire additional employees. Terry and Dottie Smith employ 80 employees in their bakery.
I'm tired of Washington telling me how to run my business. I don't think that they have the experience that I have. I've been doing this for 40 years, and I'm just tired of them telling me what I need to provide for my employees, because I know by hearing from my employees what they would prefer to have.
Those in Washington pushing the current version of healthcare reform promise that for the Americans who have health insurance, nothing will change. But with controls and lack of competition, change is inevitable.
If the government got involved, that we would lose that competition, and that we would not have the best health care in the world.
Government-controlled health care in England and Canada has opened the door to abuse in the system.
So many people cheat. You know, you give somebody something free and it's abused.
Because there's absolutely no charge to anybody in Canada, so they can walk in the office and walk out. I had one girl come in sometimes 3-5 times a week, every week for 2 years.
The only way to pay for expensive and expansive coverage will be huge tax increases, which have been the case in Canada and England, where the marginal tax rates are very high.
The government has not got enough money to run it. The people are not prepared to pay a lot more. They grumble every time they're asked to pay more tax.
People in Canada think their health care is for free. I still haven't seen that money tree in anybody's backyard. But what happens, they're paying income tax at 60%. They don't have tax-deductible mortgages, and that makes a difference. So you're going to have to raise income tax here up to those countries like Canada, Britain, the Scandinavian countries paying 60-70% of their gross incomes. That's what it's going to take to get that type of health care.
Please join us for our next API New Media release when we look at alternate ways to reform healthcare while controlling cost, making healthcare more accessible and preserving our right to choose our own doctors. For API New Media, I'm Amy Beth Shaver.